This is the Emergency Medical Minute. The Emergency Medical Minute is excited to announce that we are now offering AMA, PRA, Category 1 credits via online course modules. To access these and for more information, visit our website at www.emergencymedicalminute.com/CME-courses, or simply click on the link in our show notes and create an account.
Okay, folks, I thought I would talk a little bit about hypoglycemia. I've noticed recently, and I don't know if others have noticed, that we're seeing, particularly Denver Health usually comes in with D10 rather than D50. I don't know if others have noticed that, but we're seeing less and less D50 being administered in EMS for diabetic emergencies. And the reason behind that is primarily just availability of the med. There have been shortages over time and that have kind of forced people to revisit using lower concentration dextrose. And in my own mind, I was kind of always felt uncomfortable with that. I wasn't totally clear what the science was, if that was adequate in terms of glucose or dextrose calories and volume and things like that. So I did a little bit of looking into it and came across a really nice piece by Michelle Lin in the Academic Life in Emergency Medicine blog. And basically, there's actually pretty compelling evidence that might be a better way for us to treat hypoglycemia than using D50. So when we give D50, that's more concentrated than hypertonic saline. So there's downsides associated with giving like hyperosmolar solutions, primarily in terms of vein injury and things like that. So there's probably particularly good argument for using the dilute or D10 concentrations of dextrose, particularly if you have kind of a tenuous IV, like a little guy in the back of the hand or something like that. It's much less likely to blow. And secondarily, when you give a large volume of glucose or dextrose, which is converted to glucose, what happens is you actually suppress gluconeogenesis, so the liver making more glucose, and what's called glycogenolysis, where the liver is breaking down glycogen, and also muscles are breaking down glycogen to raise the blood sugar. So you actually may have more rebound hypoglycemia when you give a very large bolus of glucose. And then lastly, when you might be concerned that you're just not giving enough calories, remembering that 25 grams of D50 is only 100 calories, right? So it's not a lot. But it turns out when you look at head-to-head studies of an infusion of 250 cc's of D10 against that push of 25 grams of D50, that you actually achieve normal glycemia at the same rate, usually in about 8 minutes. And there is no difference in the likelihood of dropping your blood sugar when you measure them out at 2 hours later. The average blood sugar for both is over 100. So while the blood sugar is a little higher with the D50, it's actually probably too high. So I think the take-home point here is don't be alarmed when EMS is giving D10. That's okay. It still works just as well. Number two, if you do have a tenuous IV, we should probably consider using that instead. So feel free to recommend that to your doc or APP who you're working with if you're having trouble getting access. And the volume is 250 cc bag of D10 water. So that's going to give you plenty of calories and plenty of dextrose to fix the problem. Thank you.
Hello, EMM listeners. We are dedicated to providing you with high-quality educational content free of charge and without ads. As a nonprofit organization, we rely solely on donations. So if you enjoy our show and are able to make a one-time or recurring donation to help cover our operational costs, any amount is helpful in making this show possible. Click the link in our show notes to make a donation. Thank you.